Hello, everyone, and welcome to For Head's Sake, formerly known as Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, founder of Migraine Nation and chronic daily migraine survivor. Our topic today is stigma, migraine, and headache disorders. Does stigma actually make us sicker? This is a big deal because I think that a lot of people just hear about stigma. They think it's something we just deal with, live with, fact of life, but no one really takes it a step further and thinks about whether or not it can actually make us sicker. And that is what we're going to talk about today with two very knowledgeable guests. Both our guests today are well known in the migraine community and have recently, published and presented data in the area of stigma and migraine. I am here today with Dr. Bob Shapiro and Dr. Dawn Buse. Hello to both of you. How are you?
Hi, Lindsay. Thanks for having us.
Hello.
Thank you for being here. So I'm going to have both of you tell everyone a little bit about yourselves. You both do so much awesome work in the community, in the migraine and the headache community. You're both researchers on the Overcome study, which is the biggest study of people with migraine to date. And you presented this data at the AHS meeting this year. So Dawn, or Dr. Buse, let's start with you. Our audience is pretty familiar with you. You are on a lot. Can you just tell them a little bit about your background?
Yes, hi, thank you, Dr. Weitzel, Lindsay, and hi, audience. Good to see you again. This is such a great topic. I'm so happy to be here. I'm Dawn Buse. I'm a licensed psychologist. I've spent my whole career working in the field of migraine, headache, and other painful chronic conditions. I am a clinical professor of neurology at Albert Einstein College of Medicine and a former member of the board of directors of the American Headache Society.
Okay. Dr. Shapiro, can you tell us a little bit about what you do? You do so much work for us when it comes to whether it's Headache on the Hill or anything. I see you everywhere. So for anyone that has not gone to some of the places that we've been lucky enough to go to and hasn't seen you, can you please tell our audience a little bit about what you do?
Thanks. So I'm a professor emeritus at the University of Vermont at the Larner College of Medicine. I'm a professor of neurological sciences. So I'm a clinical neurologist, but I also do research and teaching. And but I'm also very involved with advocacy, national advocacy. And I was the founding president of the Alliance for Headache Disorders Advocacy, which is the umbrella organization which puts on the Headache on the Hill advocacy event in Washington each year.
Okay. Well, again, thank you both for being here. Let's start talking about this topic about whether stigma related to our migraine or our headache disorder can actually really affect our health. So Dr. Shapiro, let's start with you. It's important that we just begin by defining stigma. Can you go ahead and just give us the definition of what stigma is in the context of what we're talking about today?
Sure. So stigma is a social relationship. It's a set of discrediting or devaluing attitudes which individuals may hold with respect to other individuals or groups because of a trait or characteristic they have which deviates from a societal norm. So other people. And life with migraine can actually make it difficult to abide by social norms or conform to them. So one so-called normative expectation would be for a parent to be able to drive their child to school, or to be able to attend basketball games, or employees to be able to show up at work each day. And the unpredictable and disabling nature of migraine can really be a challenge to be able to do that. And stigma can arise when people are unable to perform the way others expect them to. And the reason for it is a trait which is discredited.
All right, so going with Dr. Buse on this one, it's my understanding that there are numerous categories of stigma or types of stigma that are important to those of us with migraine. Can you go ahead and tell us about those types of stigma?
Absolutely. So the first way we're going to break it down is thinking about if you're someone living with migraine, how do you feel about yourself? Do you yourself feel less worthy, less valuable, guilty, or ashamed? We're going to call that internalized stigma.
Right.
Then we're going to talk about everybody else in the whole planet. be they healthcare professionals, be they government employees, be they the person at your insurance company who makes decisions.
Mm.
We're going to talk about now an enacted stigma. To make it a little easier, we're just going to call that externalized stigma. It makes it kind of easier. And that's when someone with migraine is confronted by others who discredit or disvalue them based on the characteristics of having migraine. So we've got what someone with migraine feels about themselves, and we've got kind of how the rest of the world sees someone with migraine.
Okay. I think that's very important because I don't know if everyone fully realizes how subtly it can affect how we feel about ourselves when we experience stigma in our environment. So I think it can be eye-opening just to hear those definitions, I feel. So I truly doubt there is a person out there with migraine who has not experienced stigma. I had chronic migraine from the time I was 4. And I can say that when I first started pondering the idea of migraine and stigma, I remember thinking, wow, I think I really protected myself from stigma for years by going to great lengths to hide my migraine disease, right? And then I stopped and was like, wait a minute, isn't that one of the ultimate results of stigma? Is it causes us to hide and be silent about our disease. And that is exactly what we don't want to do, correct?
I believe that's true.
Yeah.
I think that hiding is one of the crux issues to understand stigma. So migraine is a disease. It's a disease of the nervous system with impacts across many parts of the body, bodily systems. But the manifestations of migraine are invisible. They're symptoms. They're not physical signs which people like doctors can detect on examination or can do tests to say you have migraine or not. So they're symptoms. And in collaboration with my colleagues at the Danish Headache Center, last year we published a study of how migraine is portrayed in the major media. Right. And we went to Google Images and analyzed this. And we found that half of all images of people who are experiencing migraine depicted them touching their both temples and squinting. Now, just like that, exactly right. Now, in my clinic, where I see people who are experiencing migraine attacks all the time, I never see people who look like this. Mm-hmm. This is not what migraine actually looks like in my experience. It may be what some people do when they're at home. So these may be pain behaviors that people have, but they don't do them in front of me when you would assume that they would be relatively comfortable in showing that they have migraine. So why? Why is this true? Well, if there are penalties which arise because of stigma, they arise because of this expectation about people having this disease, then having behaviors which reveal that migraine is present can be deleterious, can be hazardous, there can be penalties. So people hide them. They learn intrinsically to hide them. They don't have to be told or taught this as an adaptation to the stigma that surrounds them. But there are problems with that as well. So if you hide and you don't behave the way people expect you to, and then you state that you have migraine, then there's this mismatch between the stereotype and the reality. And that mismatch leads to suspicion sometimes, and sometimes it leads to accusations or allegations of malingering. And so people with migraine.
So Bob, someone might say, you've been at work, you've worked at this job all year, and I've always seen you here. And they may not realize the person has actually gone into the bathroom and thrown up because they're cleaned up. They may not realize that the light hurts so much because they kind of persevered through it. Or Lindsay, starting with you as a child with chronic migraine, people at school may have not known. I don't know if you told your teachers or your classmates or kind of how that went. So it sounds like hiding is a coping mechanism that people with migraine might do because they are so strong and trying not to bother others, trying not to kind of lose their position, be it work or school, trying to kind of keep doing what's expected of them. It's actually, in my opinion, a source of showing how strong they are, that they kind of keep soldiering on. But Bob, you're saying that ultimately it doesn't serve the field or the individual.
So it leads to lots of problems. One of the problems is that people feel like they're not being their honest self, that they're not showing who they are and what they're actually experiencing. And if they acknowledge that they're experiencing it, then it leads to disbelief. And it also leads to an expectation, well, you're saying that, but I don't really see how it is that you're experiencing this. And so I'm really not sure that it really is true.
Right.
And because people experiencing migraine, for instance, in the workplace, it occurs unexpectedly or unpredictably, and people may not be able to function up to their full capacity at times. They are loath to have that be understood or detected for fear that there'll be a penalty of having their job be at risk. So people work through and plug through, and it ends up getting entrenched. People can't come forward and have it be acknowledged. The stigma is too strong. There was a study in Britain some years ago, a polling of 1,000 employers in Britain, and they were given a menu of different potential excuses that people might give to not show up for work. And migraine was on the list, and it was the least likely reason for an employer to say it was a valid reason to show up for work. About 1 in 5 employers thought it was a reasonable, appropriate reason to show up for work. And in the face of that, employees who have migraine know that they cannot risk having migraine be detected. So they live with it. So they multitask their disease and their job and their family. And I believe anyway, that the experience of doing that actually leads to resilience. I think there's some data that are emerging that might support that, but I think it's an area that really deserves significant more research.
Yeah.
Wow. Bob, that's so interesting. You talked about the images. I'm also thinking about the language, and migraine, or even one of its most salient features, the headache face, gets kind of thrown around as an annoyance. You'll see it in newspaper headlines and on social media, or hear people, use it as a kind of metaphor. Oh, it's giving me a headache. Oh, this new tax increase is a headache. It's a migraine for all of us, which, also has some devaluation to the experience of this potential many-hour, many-day, multi-symptom, terribly disabling, painful event.
Right. I do think that something that I notice is that now that I do tell people that I experience migraine, most people on this earth have experienced some sort of tension headache or some sort of head pain, and they assume that that is what I'm experiencing, regardless of, I don't sit there and explain that, how nauseous I am or how intense the pain is, et cetera. And so I do think that is also part of the problem, is that people can often just assume it's a small headache because that's the type of head pain they have experienced in their lives. So sometimes that is a difficulty for us too. So if we could go ahead, I was going to talk about how you are both, I discussed this in the intro, involved in the Overcome study, which again, as I said, is truly the biggest study in migraine that we have, that has been undertaken. And you reported some of these findings this year at the American Headache Society scientific meeting. And I was hoping that you could tell us some of the noteworthy findings, Dr. Shapiro, that were found related to stigma in the Overcome study so far.
The Overcome study, as you say, is the largest study ever undertaken at a population base for people with migraine. Over 60,000 people were polled over a number of years, a whole host of different questions about different aspects of the lived experience of the disease. And there were a number of questions that were specifically focused on attitudes related to stigma. So one of these questions, or groups of questions, started with the phrase, how often do you feel that others viewed your migraine or severe headaches as a way to, and then fill in the blank, get attention, avoid commitments, get medications they didn't need, a result of their own unhealthy behaviors, something not worth talking to a doctor about, making things difficult for coworkers, and so on and so forth. And our analysis of the responses to these survey questions led to identification of 2 themes, or what are called factors. And the first factor is what we call secondary gain. So this centers around the allegation that somebody with migraine is using it to unfair advantage, to a secondary or extra advantage. And the second factor is what we termed minimizing burden. So this is an assumption that migraine is not a serious condition, for example, that it really can't be disabling. So secondary gain effectively is or essentially is stigma towards a person with migraine, whereas minimizing burden is essentially stigma towards the disease entity itself. And there are two different ways in which people can experience this. There are probably others. We haven't exhausted the ways that people can feel that, stigma may arise, but those are the two that we really identified.
So Bob, secondary gain is like you were talking a few minutes ago about getting out of work. You're not taking on a big work project. People think that you are using migraine to get out of a big work project or chores or anything onerous that you don't want to do. So that's kind of the secondary gain. It's not that the person itself is trying to do that with migraine. It's that they think other people are viewing them as using migraine to get out of things.
Correct. And in a way, it's just completely topsy-turvy to hiding. So people who are hiding are avoiding having migraine be detected so that they're not trying to get any secondary gain, yet they're very concerned that others believe that they're trying to do this. And this may actually magnify the hiding. That's certainly a possibility.
That makes sense. And the other thing you said was that minimize burden so that their friends, their family, their coworkers don't understand what a big deal migraine is, how painful, how disabling, what all the symptoms are. So people who responded to our survey feel or believe that the people around them really don't understand how disabling and impactful migraine is.
And part of that may be related to what you mentioned, Lindsay, that their experience is headache. And they can manage that. It's not something that leads to any impairment or disability for them. And also the usage of the term headache is, principally as a metaphor of annoyance rather than a medical condition or symptom. So there are many reasons why it's kind of understandable why people might have these malign attitudes. And we found that in the Overcome study that about a third of people with migraine reported either the secondary gain or the minimizing burden or both often or very often. So it's a very, very prevalent issue.
Right.
And the frequency with which people experience headaches actually influences this a lot. So for example, while a third of people overall report often or very often stigma, for people who have relatively infrequent headache, 0 to 3 days per month, about a quarter of them have these feel these stigmatizing attitudes, where for people who have chronic migraine, which is 15 or more days with headaches per month, it's full half of them often or very often feel stigma. So there is a relationship between how often people experience symptoms of migraine and how often they also experience this more severe form of stigma.
Which is not surprising at all. It's harder to hide the more often it's there. It's also, you have a more difficult time keeping up at work and with your family obligations. And so it's much harder to fulfill the roles that people think you should fulfill once you're chronic and the more frequent your migraine is.
Right. So when we think about that, like in numbers, if there's 40 million Americans with migraine, we've got 20 million people who feel quite stigmatized by having migraine. Or when we think about a billion people, over a billion people around the earth, that's 500 million people feeling pretty stigmatized about having migraine. This is not a small problem or not a small issue. And if you are feeling it, you're in a big boat with a lot of other people. You're not alone. Yet feeling alone actually is something that keeps us feel more stigmatized, is that feeling that we're the only ones.
Yeah, no one is alone. No one who's being stigmatized or is feeling stigma at work or at home or from your family or anywhere else. You're not alone. We have all felt it. We are all continually feeling it.
There are other consequences to this.
Go ahead.
That emerge from the Overcome study. And the topic really of this is whether or not stigma is associated with being sicker or getting sicker.
Right.
And we can't say that it causes it, but we can certainly say that it's strongly associated with it. So there's a way to measure migraine-related disability, and we ask the questions that allow us to assess that. And we found that 3/4 of people who report stigma often or very often have at least moderate levels of migraine-related disability, whereas those people who reported that they were not experiencing stigma at all, it was 1/4 of that. So there's a 4-fold difference in experience of migraine-related disability if stigma is present in its more extreme forms. And we also asked questions about another way to think about how migraine has impact, which is called migraine-specific quality of life. And there's a well-validated set of questions, which Dawn actually invented to assess this. And this is really, I think, maybe the most striking finding that so far with relation to stigma for the Overcome study. We found that stigma is more associated with impaired or worsened quality of life than the frequency of headaches. So put this another way. So people who had 0 to 3 headache days per month, but reported stigma often or very often, reported worse quality of life than people who reported no stigma at all and had headaches every single day. Okay, so we can
so all three of us have migraine. I know that, right? So I'm kind of outing us. All three of us have migraine. So we could each have the same number of days with migraine every month. So let's say Lindsay had 8 last month, Bob had 8 last month, and I had 8 last month. But Lindsay's feeling a lot of stigma. And for whatever reason, I am not feeling as much stigma. Maybe I have better social support or better understanding folks around me. That means that Lindsay's going to have significantly more disability, more time missed at work and school and family, social, leisure, and chores. Not that we miss chores, but we need to do them. And significantly worse quality of life. So even though we all have the same number of headache days, those that are having high stigma also have this really tough kind of negative impact on their life, which really adds to the experience of migraine. Not only the attacks are painful and debilitating, but the rest of your life is affected. So that's pretty important for doctors to know, to treat people. It's pretty important for society to know that stigma really matters in how people are living their lives.
Important for patients to know. I think it's important for us to recognize in ourselves, in our world, in our environment, and realize that it's not just a benign thing when we're experiencing these types of stigma, and to change the type of environment we're in, or speak up for ourselves, or to just take care of these problems so that we are in a better place and that we don't have as much disability. And so that's part of why I wanted to talk about this. And Dr. Shapiro, was there any more you wanted to say before I move on to the next question?
Sure. So just to kind of summarize it, what I've taken away from this is that the social context of migraine is as important as the personal experience of its symptoms. So migraine is kind of universally associated with headache, and people assume that that is what is the driver for disability. But it may not be the only or even the most important driver. We don't know. But our findings point to stigma as a much misunderstood contributor to reduced quality of life. And in this comparison between headache frequency and magnitude of stigma is a better predictor of worsened quality of life. This was a very surprising finding.
Right. So I'm going to ask this question in a way that people with migraine can sort of recognize some of the levels of stigma in their world. So we spoke in general, Dr. Shapiro, about the effects of stigma and that it can have effects on our health and our disability levels, et cetera. But are there other negative effects of public or external stigma? What is in our environment, in our world, what is being affected strategically in our world by migraine stigma?
So when stigmatizing attitudes among individuals become prevalent enough, when enough people carry these stigmatizing attitudes, they seep into the fabric of society. So they become endorsed at a societal level. They become present in the structure of our institutions and our laws and our policies. And at that point, it becomes something called institutional stigma. And public or institutional stigma has major consequences. And the consequences are inequities in the division of resources. So people who are stigmatized in this way are not able to overcome, to not exhaust that term, overcome the barriers which exist. So this means less likely resources in terms of NIH research to find better understanding of the disease and better therapies. This means policies for making legitimate claims for disability, for health and disability insurance, whether it's from the Social Security Administration or workers' compensation. This means that doctors may carry attitudes, and this may carry into the institutional policies of hospitals, where they don't see migraine as being as important or as prevalent as it is. This can carry into the workplace, where application of the Americans with Disabilities Act may be not available to people who have migraine. So reasonable accommodations to ensure that people are able to work to their full capacity and live their lives to their full benefit. These are all things where everywhere you look, where it's possible for the people with migraine to receive less than the norm, we see that they receive less than the norm, which is one of the reasons why we go to Washington every year, heading on to try to change some of these policies at the federal level.
Exactly. All right. So that is such an important viewpoint, because I want everyone to be able to recognize now all these places in their environment where they might be experiencing stigma that they didn't totally notice before. And so I love that you just spoke to that. And now I wanted to talk to Dr. Buse about something that I think is really hard hitting in this episode, and it has to do with internalized stigma. As a psychologist, I wanted to direct this toward Dr. Buse, because how do we improve our experience once we have actually internalized these attitudes? So now let's say our audience members are understanding now, oh my goodness, I could be making myself feel sicker. I could be experiencing worse levels of disability because whether I have consciously or subconsciously internalized these attitudes. So what can we do once we know this has occurred? How can we improve this?
Well, let's think about it in terms of some other diseases that used to be very stigmatized, that have done great PR campaigns and strong advocacy. Let's think about breast cancer. Now, that's something that a couple decades ago, we wouldn't have talked about our breasts, let alone had huge marches and been one of the most powerful fundraising groups ever of all time. Or HIV/AIDS, something that really started out very stigmatized, that individuals felt very guilty, personally responsible, embarrassed, not worthy. There are other disease states where together, communities of patients and healthcare professionals and scientists together have really pushed together to bring those conditions out into the light, get funding, and get much more acceptance for individuals. So when we start with ourselves, what can we do first with ourselves? Well, first, we can stop hiding. And if all of us were to stop hiding, if all 40 million Americans and all 1 billion people around the world were to stop hiding, the rest of the people who don't have migraine would start seeing what it really looks like, how impactful it is, how disabling it can be. So there's just a benefit to that on its own.
Right.
Communicating openly with the people who are in our lives, be they family members, friends, co-workers, bosses, to the extent that's appropriate for the situation. For a family member, we may want to bring them to the medical appointment with us so they can hear about treatments and symptoms and understand how disabling or how impactful those symptoms can be. For in the workplace, we may need to go to our boss, our supervisor, or maybe we go to HR and we talk about our legitimate rights for accessibility and for other sorts of accommodations so that we can work at our best, work as well as school. There's some great initiatives out right now. There's Migraine at Work, which has a great website. There's Migraine at School, which has a great website. Two great kind of educational advocacy initiatives that give you paperwork and guidance and info and all sorts of tools to help advocate for yourself.
Right.
Now, advocating for yourself may sound like a very big leap to go from kind of hiding and always keeping it quiet and doing your best to get along to now kind of moving to a public advocate. And there's a whole bunch of ways and steps that you can start that process. And so kind of start wherever you are and what feels comfortable for you, but doing things like listening to this podcast and then maybe sharing it with your loved ones or family members or colleagues is a great thing to do. Things like looking on some of these websites that have advocacy information, like the Alliance for Headache Disorders Advocacy, AHDA, that has all sorts of ways, kind of big and small, to start advocating. And there's something that really produces confidence from that. So stigma itself can be soul crushing. People feel guilty for having a neurologic genetic disease, genetic predisposition disease that is in no way their fault. And yet they feel guilty, they feel embarrassed, they feel less than. The more we start to turn that around, you will also have your confidence start to come back, and starting to feel more confident as you do and you speak with those around you. They're going to hear that, and they're not going to hear you feeling guilty. They're going to hear you explaining what this disease is.
Right.
And finally, we can't always choose, excuse me, who's around us. We can't always choose our coworkers or our boss. We can't always choose our family members,
Right.
but we can choose who we really confide in, spend time with. So find that supportive community wherever they are, be they virtual, be they in person, people who are like-minded, people who kind of bring you support and acceptance. And don't accept any less from your healthcare professionals. You deserve to be listened to be respected, and to be cared for. And if in the healthcare professional relationship, you're not getting that, boom, you're out of here. Go break up with them and find someone else, because you deserve that. So there's a couple places for us to start.
That's great advice, but I want to put out there, I'm really glad that you brought up breast cancer as the comparison. And I'm sure that you remember, we have talked many times on podcast episodes how I used to work in the breast cancer field and do research, clinical research, and I talked to breast cancer patients all day. And I don't even want to say how much I weighed back then, because the daily nausea and vomiting was so extreme. And the reason it was so bad was the one medicine that helped me with my nausea and vomiting was only okayed by my insurance for people with breast cancer or people with cancer. And so I pretty much weighed less than all of the cancer patients I talked to during the day. And it became this thing for me where it became very obvious, the difference between the two diseases of migraine and cancer, and how much more respect cancer received. And I started to notice in my brain that they were seen as warriors. They were seen as very strong, whereas people with my disease were seen as weak, and et cetera. And I decided very early on that no, that was the mentality I was taking. I was a warrior. I was a survivor. I was going to overcome this. I was going to find a way to get the medicines I deserved. And so I think that I always want to tell people that, yeah, when it comes to, if you notice you internalize some of those attitudes, think of those words. Think of the words that the cancer population has taken on. Think of that warrior mentality and find that in yourself and see yourself that way. And I think that that is really, really an important step in this process. And I just wanted to throw that out there. So I have a question for Dr. Shapiro. I feel it's so important to address that internalized stigma, because it's really hard to address stigma outside of ourselves if we have not convinced ourselves that we're strong, et cetera, if we haven't changed things within ourselves. But how do we then, once we have taken care of how we're feeling about ourselves, go about changing that more public or external stigma? What can we do?
So I think this is the hardest issue.
Mm-hmm.
People with migraine, as I said, we all said, learn to hide it. It's the safest thing to do, but yet it perpetuates the thing that oppresses. And getting away from that, emerging from that,
Mm-hmm.
requires an article of faith. This is going to lead to something better. So Dawn mentioned community. Community helps allow people to move in that direction, which is the necessary, is my own belief anyway,
Mm-hmm.
the necessary process. So there have been other diseases, mental health or substance overuse conditions, where the evidence really points to contact being the most effective strategy for overcoming these malign attitudes. and contact meaning people who are the focus of stigmatizing attitudes coming into direct contact with people who carry the stigmatizing attitudes.
Right.
And this is an incredibly hard thing to ask people to do because it's contrary to their instincts. But the example I think is also very valuable is the one, Dawn, that you mentioned, which is HIV/AIDS. So when I was in training in the mid 1980s during in New York City in the emergence of the AIDS crisis, the gay men's population, which was extraordinarily stigmatized. Their behavior, sexual lives were illegal in most jurisdictions. And so hiding was a necessity and was not challenged by anybody. All of a sudden, they were additionally burdened with the idea that they were the ones who were perpetuating this plague in the population. And they did something truly remarkable. They became activists as a community. A huge number of them chose to actually come out of the closet, to identify themselves, self-identify as being gay, and demand that there be attention to this disease. And they changed NIH, and they changed the perspective of the disease. And they also, at the same time, changed the whole perspective on gay life as being an acceptable fact of our community. And those are the crucial side benefits of being active in this way, of coming away from hiding and acknowledging that this is part of your life. You certainly, by contrast to gay life, anybody with migraine typically wants to get rid of it. And we have to acknowledge that's our goal, is to treat this. But until we're at a point where that's available, I think that the necessity is for people to emerge and stop hiding. And it's easy for me to say, but I think that it's really an important thing for the community as a whole, which is a very large number of Americans who are experiencing this, and a large number of families who collectively experience it, that if we can mobilize the community well enough, then that'll be crucial. And from the standpoint of the institutional or public stigma, trying to change policies in government or in other institutions, insurance policies and the like, this has obviously the beneficial effect, when successful, of changing the landscape, but it also validates that this is an important area for people to acknowledge that they live with this. And I think we can all contribute to that. I think everybody has the advantage that they can be their own advocate. And going to Washington is extremely valuable, but you don't need to go to Washington to make a big difference in your own space.
And I like to tell people that it can be scary, and we're not, if you think it really would badly affect your job, that maybe that's not the first place that you have to talk about migraine. We don't want anyone doing that if it's going to be a problem. But I think that I like to tell people that, yeah, it can be scary if you're someone that hasn't talked about the fact that you have migraine, but it's one of those things that I always talk about, water off a duck's back. Dr. Buse has heard me say that if someone doesn't like what you said about the fact that you have migraine, etc., water off a duck's back. Next person. It doesn't matter. We aren't here to make everyone like us. It's not really our job on this earth. Not everyone has to love us. So that's how I personally feel about it. When I talk about migraine, I've had plenty of people that just don't care and don't really think it matters. And that's fine. And it's not my job to change everyone's mind, but it's my job to change the minds or hearts of people who are ready to listen. So that's how I personally feel about it. Is there anything else either of you would like to add to this discussion of migraine, headache disorders, and stigma? I really love this topic, and I love everything that you guys have added, and I just want to thank you so much for everything you've said.
Well, Lindsay, I think that's really an important point, that this might sound a bit overwhelming to some people to think about
Mhm.
advocacy. And Bob, you said you don't have to travel to DC to be an advocate. You can be an advocate right in your own workplace, at your child's school, in your own home with your own family members. Start where you are and what you feel comfortable with. But ultimately, whatever helps you reduce feeling guilty and responsible for this neurologic disease that is not your responsibility, that you did not
Mhm.
cause or ask for, whatever helps to start lift that burden actually will improve your outcomes for your life with migraine. So we
Mhm.
want to remind you that anything that you do might start making life feel a little better, a little easier, for a whole host of reasons. So we just want you to take care of you, starting in whatever ways feel like where you want to start.
Right. That's a great message. Did you have any closing thoughts, Dr. Shapiro?
Just thanks for devoting an episode to this and drawing attention to it. We're pretty enthusiastic about this as being an important area. So thank you.
Thank you. And thank you both for being here. And thank you everyone for listening in this week to For Head's Sake. Please join us again next week on the weekly podcast and webcast of the National Headache Foundation. Goodbye.